Hello and welcome to Transforming Healthcare, the people behind the progress, a series from HSE Technology and Transformation. My name is Joyce Shaw, I'm Chief of Staff, and today I'm joined by Dr. Colm Henry, Chief Clinical Officer in the HSE. Today we'll talk about the digital transformation underway across the HSE, what it enables for patients, staff and services, and how we keep change grounded in safer, better outcomes. Colm, when you look across the HSE, what does digital transformation mean in practical terms? And what do you most want staff and the public to understand about it right now?
Well, if we look at what's important to patients in 2026, what people would expect from healthcare is they expect access to expert opinion, they expect advice, they expect the healthcare to be safe, and they expect the information that's relevant to their condition to be available wherever they may present, whether it's in a GP surgery or whether it's in a hospital, the local hospital, or whether it's in a hospital that's far away from where they live if they happen by bad luck to go in there sick. The reality is that there's a mismatch between expectations for 2026 and what we deliver, because we deliver healthcare in some cases with a healthcare system that is much older than 2026, maybe 1976. A paper-based system where we don't have information where patients present, where we don't have shared information the way we would like it, the way the patients would expect, whether it's primary care or in a hub or in a hospital, and where we don't have people, we don't even, our ability to measure how safe care is, to audit, for example, we can't measure in real time. Recently, I had the opportunity to visit Bart's Hospital in London, where I saw a fully integrated digital healthcare system. And what I saw was a system which was able to oversee and have access to information on patients wherever they were in that trust, multiple hospitals, different settings, emergency departments, the ambulance service, critical care units, the healthcare professionals at all these multiple settings in what is a very complex healthcare delivery system had access, real-time access to the patient's information that enabled them and empowered them to make the right decision for patients. And where something as simple as medication reconciliation, which is what are the correct medications an individual is on any one day, was available to everybody in the same place at the same time. That's what patients would expect from our healthcare system. We're not able to deliver it now because we're quite far behind in this country and we're playing catch up. But the digital healthcare strategy and the single electronic healthcare record will enable us to deliver that kind of vision and match the expectations that patients would have in 2026.
From a staff point of view, what should digital be improving in day-to-day work, and what changes make the biggest difference on the ground?
I think we have learned lessons from, and hopefully will continue to learn lessons as we roll out the single electronic healthcare record in our own healthcare system and the shared care record. What we've learned from other systems is that we don't want to displace the time that clinicians, whether they're doctors, nurses or healthcare professionals, we don't want to displace the time they spend with patients. We want to free them up to have more time with patients. And I recently attended a King's Fund Leadership Summit where I saw the national lead for AI in healthcare, he's a paediatrician, talk about he wants more time to talk to children about dinosaurs. And I was very touched by his first of all, his thoughts as a clinician as to what AI and digital healthcare should do for him, but more importantly, what it would do for the patients who are coming to him. That instead of him staring at a computer, of him as a clinician serving a digital system, it's one aspect of a digital system, and one element of power of the digital system, namely AI, would free him up to do what's important. And I think that, to me, captures the most fundamental lesson of the rollout of digital care anywhere we've seen, and will be a fundamental principle we will need to adhere to in this country. Is what we need to do is not displace the valuable clinical time that clinicians have with patients. We need to enhance that and free clinicians up to spend more time using their training, their clinical judgment and their expertise to deliver the kind of care that patients expect.
Colm, how do you make sure digital change strengthens patient safety and quality rather than adding new risks or workload? You know, what does good look like from a clinical governance perspective?
Well, safety is a big interest for me in my job in the HSE, and and it's a preoccupation, a primary consideration for any clinician on the front line is how to deliver safe and effective care. One of the problems with paper-based systems is not only is it unsafe because you're dealing with physical notes that may or may not be available, that may or may not reconcile with notes elsewhere, that may be duplicated, but you can't even measure effectively how unsafe healthcare is, because the very process of audit, which is how we measure care against a standard, needs to be carried out manually. So we're doubly disadvantaged in that we deliver a form of healthcare which is less safe because it's paper-based. And when we set out to measure its safety, it takes us much longer than it would in a digitally enabled system. So one of the things struck me again in seeing some of the places where this has been rolled out is how much all healthcare professionals who are interested in clinical audit and interested in safety, how they have harnessed the power of digital care to measure safety in healthcare. For example, medications, for example, appropriateness of care, clinical outcomes, how they've used that, not just in the process of more accurate measurement, but in the timeliness of how they conduct clinical audit. It's much more real time compared to a paper-based system, which is manually performed and is historic. Sometimes some of our audits, the results and the reports we produce are a year or two old by the time they're validated, and that is less real and less applicable and less useful in terms of promoting a safety agenda.
Colm, how should we judge whether digital transformation is working? You know, what outcomes or measures matter most to you clinically and operationally?
Well, the fundamental way healthcare is delivered is personal. It's between a clinician, whether it's a doctor, nurse, or healthcare professional, and a patient. And that's not going to change, and it shouldn't be displaced or replaced. So there will be all kinds of metrics about the access to care, the safety of care that we can use. But fundamentally, the measure of success will be how much clinicians are enabled to deliver personal care, how much time is freed up, how more effective that care is, how safer that healthcare is by having real-time access, for example, to medication or to the patient's medical records. So whatever way that spins out in metrics is for another day. But fundamentally, patients and healthcare professionals on the front line will judge its success by how much they're freed up and enabled to deal with patients in addressing their problems wherever the patients may present.
Colm, what helps clinicians and teams adopt new digital ways of working successfully, and what do you think we need to do more of across the system?
Well, what we've learned in our own healthcare system and looking at other healthcare systems, particularly looking at our own healthcare system, for example, modernised care pathways, where we devised new ways of delivering care, new points of access for care, using all members of the multidisciplinary team, was when you, and of course during the pandemic, when we had to devise at scale and at pace new ways of accessing care, often virtual to avoid footfall in the hospital if that could be avoided, was that these are best done when clinicians are involved in the design of the pathways from the outset, harnessing patient experience and service user input, because it's at that level that people will understand what's important. What is important is the time that's spent between clinicians and service users. What is important is the information that's available then. What's important is that the decisions that are arrived in any one consultation are safe, effective, appropriate, and are focused on the patient's needs and experience. And so what is critical for us now as we embark on the electronic healthcare record, for example, is to ensure that there are clinicians involved at the outset in the design of what we need in a record, so that ultimately would translate through to more effective, more safe, more useful, more meaningful patient's experience at the front line. And so service users' involvement and of course clinicians involved and leading out in design at the outset.
Colm, you're working to update the HSE's clinical governance framework to reflect new models of care and the growing role of digital. Do you want to tell us a little bit about what that is?
That's an important piece of work for my office, for the clinical community and for service users and patients and their families, is where we're updating is what constitutes a framework for the delivery of safe, effective care that now acknowledges and brings in those 6 healthcare regions that are now responsible for the entirety of care, both community and hospital care, right across each region. So part of this, what governance, clinical governance covers, of course, is the responsibility for ongoing safety, ongoing improvement, and ongoing quality of care in a continuous way. So it's very clear to patients and service users when they go into any healthcare setting, who's responsible for my care in this setting, who's responsible for my episode of illness, whether it involves my care in a GP surgery or in a chronic disease hub or in a hospital setting. So as we're planning a framework and it's coming to completion now, that we hope will last a generation, we have to factor in that most of our healthcare professions, and in a short time all of our healthcare professions, will be working in a digitalised environment. So we need to ensure that digital healthcare is integral to clinical governance, that if care is digitally enabled, if there are virtual clinics, for example, that it's very clear in terms of the responsibility, the ownership for the delivery of that service, for the safety of that service, and for the constant continuous improvement of that service. So it's one of the main pillars of this clinical governance work is digital healthcare.
To finish, Colm, what's one message you'd give to staff who are feeling change fatigue but still want to see the systems improve?
Well, clearly I would empathise with anybody who sees we've come through a pandemic. Our workforce performed heroically throughout the pandemic, and we've now implemented new healthcare regions, so there's been a lot of change in recent years in the HSE and Irish healthcare. But to go back to my original comment, what I would say to people who look with maybe some weariness at this is that the kind of healthcare we deliver now doesn't match the expectations that the patients whom we serve would expect in 2026. It doesn't match it in terms of the information that's available to our healthcare professionals in most places at the time of consultation. It doesn't match it in terms of the safety we would like to be able to assure people we have, because we're delivering largely from paper-based systems. So what I would say to people is for healthcare professionals is get involved. This can't be done to you, it must be done by you and with you. And the only way to do that is that, as I said, for digital, the best forms of digital health that we've seen implemented in recent years, whether it's virtual wards when we start them in Limerick and Vincent's, or whether it's the modernised care pathways, which involved pulling out some of the care from waiting lists and consultant surgeries to be delivered within the community setting, is they were designed and led by clinicians. Is get involved, make sure that if there's a record being designed, that the pathways within that record, the information from that record is relevant to you and your colleagues in the front line and enables you to give more effective, safer and a higher quality care to the patients whom we serve.
Colm, thank you very much for your time today. We appreciate it.
Thank you.
Thank you for watching, everyone. To keep up to date on the people and programmes driving digital for care across the HSE, please follow us on our social platform at HSE Technology and Transformation.